Intravenous IV cannulation. Intravenous IV cannulation is a technique in which a cannula is placed inside a vein to provide venous access. Venous access allows sampling of blood, as well as administration of fluids, medications, parenteral administration, chemotherapy, and blood products. Objectives. An IV is a small plastic tube inserted into a vein, usually in your hand or arm. An IV is used to provide fluids when you are dehydrated or can't drink, give a blood transfusion, and administer medication directly into your bloodstream. Some drugs work better this way. What equipment do you need? Gloves, tourniquet, alcohol swabs, cannula, choose the appropriate size, dressing, sterile transparent inclusive, sharps, disposable bin close by.
I'm just going in over the site that I sterilized. I'm looking at the chamber for flashback. I see flashback, I level out as you can see, and then I advance even further, a few millimeters, and then I thread off. Next thing I do, I put my thumb proximally and feed the needle off. This needle goes straight to the sharp spin, and then this hand goes over here to the tourniquet, and that eases the pressure there. Next thing I do is I take the IV bung. Now note that I don't have a spare hand free to stabilize the cannula, and that's okay. I just jiggle it on like that, and once it's pretty much on, then I can stabilize the cannula and make sure that this is nice and tight. I then take this cap off, ready to go. My very next step is to flush. So I just push it onto the end and just make sure that it flushes easily. Once that flushes the saline, that can be disposed of as well. And finally, I put that, and these are really great because they come with these little dated stickers. So I'll put that.
This is equipment for IV cannulation. What are the signs of a good vein? Visible, soft, as a large lumen, above previous sites, well supported, straight, and easily poppable. The preferred sites for IV cannulation: hand, dorsal arc veins, median and decubital, cephalic and basilic veins, and foot, dorsal arc. Choosing the catheter gauge. This specific gauge of catheter the use depends on the clinic scenario. The narrowest catheter typical use in pediatrics in a 22 gauge, which is sufficient for the routine administration of maintenance fluids and antibiotics. A 20 or 18 gauge is necessary for the administration of blood products, and a 16 gauge needle is preferred in resuscitation settings when large amounts of fluid must be given quickly. An 18 gauge catheter in the antecubital fossa in the standard device for IV contrast. Remember, because one small act can save or cost a lot.